I want to talk briefly about some issues related to neurofibromatosis. Remember, that's that syndromic disorder where patients could have the cutaneous neurofibromas and the spots and all the other findings in some cases. So a lot of these patients have cutaneous neurofibromas. These are neurofibromas that grow on the skin. And depending on where they're located, how big they are, they could be bothersome for patients. These are rarely malignant. They're almost never malignant. They can be, but that's really, really unusual. More likely, these are just benign tumors that are bothersome to the patients. And so we actually sometimes remove these if they're really bothersome. For example, tumors that are on a wrist where a watch could irritate them, or maybe tumors that are on the skin near a bra line or where a belt line is. Patients will often want to have those removed. Or just tumors that are somewhere that are cosmetically not favorable. You don't want people looking at this thing growing on your face or neck. There are reasons to take these out. And again, we don't chase after every cutaneous neurofibroma, but we allow the patient to pick which are the ones that are really bothersome for whatever reason, and we can remove those. And usually remove them with an elliptical incision, which seems like it's a lot bigger than it needs to be, but that allows us to make a nice linear closure that minimizes the amount of scarring afterwards. Plexiform neurofibromas sometimes appear in patients with neurofibromatosis. These are rather tumors that form along the course of the nerve that are intertwined with the nerve fibers, and they can't be teased apart like a regular nerve sheath tumor. So these are generally not surgically resectable without sacrificing the nerve itself, which is not something we really ever want to do unless we have to, unless, setting of cancer or something else. So normally we just watch these. Now, the new MEK inhibitors are a nice way of treating patients with plexiform neurofibromas, and that can arrest the growth in some cases and sometimes even shrink some of these lesions. And your doctor can talk to you about the drug strategies here. The downside of the plexiform neurofibromas, in addition to not being surgically resectable, is that 10 to 15% can actually turn into cancer over the course of someone's lifetime. So it's important to be aware of these and to monitor these with periodic imaging studies to make sure that they're still behaving themselves. And if they start to get bigger, or if the nerve or the extremity that's involved with the plexiform tumor, patient develops pain, a rapidly enlarging mass, or something like that, deficits, numbness, weakness, that could be an indication that the lesion is becoming more aggressive, and that would be a reason to get more prompt medical attention. Okay, so in those cases, you would then pursue the sort of cancer pathway we talked about before: the CT PET scan, the tissue biopsy, and possibly surgery if it ends up being a cancerous tumor. So in the end, what can I expect as a patient? Well, fortunately, like I said, the overwhelming majority of peripheral nerve tumors are benign. Most tumors don't need surgery. We observe them, and if they're growing, if they grow slowly, they still may not need surgery. But if they're really starting to get big or bothersome, or for whatever reason the patient really just wants them out, then we can take them out. And when we take them out, it tends to be a very straightforward surgery, depending on the location. Bigger tumors that are in parts of the body that are harder to get to, those are higher risk. They may need a multidisciplinary surgical team to take them out. So